My name's Jessica Oickle. I'm a registered dietitian and certified diabetes educator. My past work experience is with Big Stone Health Commission, and that's where my experience and my admiration with Oickle team and their diabetes virtual care clinic came into play. Some of the main challenges I find in rural, remote areas are continuity of care. That's a big one for me. Finding a provider or a healthcare team that can follow a patient on that care journey is so important, and I find with the Oickle clinic you get that. It's virtual, but you have that continuity of care. So, with certain communities sometimes there's higher turnover rates, and then that breaks that care continuum for the patient. I found access to food as a major barrier. Even though this community is not necessarily too far north, it is a rural, remote community. There are no, say, bigger box stores there for community members to access that food. And when I had first moved to the community, I was quite shocked when I went in the store and I saw some of the food prices. It was quite astronomical, and there's not much fresh produce, so a lot of prepackaged things that's more affordable. Again, and being in a remote area, transportation as well. So even if we would like to go outside community to get groceries, it's an astronomical cost. You have your gas and then getting the groceries, coming back. It's a lot of time, effort. I think one case in particular I can think of was an individual that was diagnosed with diabetes in their teen years, and they had diabetes for many decades, and perhaps had maybe slipped through the cracks for their diabetes care and management. When I referred this person, I was quite shocked. They had never seen an endocrinologist, and they had some complex health history. So I think being able to reach out to this team, having that support for a patient, for the communities, is really valuable. So with my experience at Big Stone Health Commission, in regards to being cultural safe and having that sensitivity in the community is very important. I think the way we are taught in school, as healthcare providers, it's sort of maybe, an expert view, authoritarian type of style. It's not necessarily empowering to the patient. Whereas I believe to be culturally safe in community, we want to ask permission. We want to ask permission in an appointment if I can talk to them about what they're eating or what medications they're taking. And with that, create a dialogue, create a relationship with the patient that we can move forward with. So again, yes, it is my job to, offer guidance, suggestions, but really, it's the patient that gets to choose. They have the autonomy to choose their path and what they want to do for their health. I just think from the patient feedback I've had, it's such a positive experience, and I believe the experience is more patient-led rather than provider-led, and they give more choice to the patient, which is what I love. So I'm hoping they can empower more patients out there that need the support.